So it takes a lot of discipline and work to get to a high rank in many professions, right? Or in many studies. Like if you wanted to be Einstein, that's tough.
Yeah.
If you want to be a doctor, that's tough. If you want to study law, that's tough. The degree of impact of those respective careers or any careers is different though, right? As a doctor, you are literally in the one-on-one capacity of doing things that will save people's lives. Essentially, every person who comes to you, they come to you because they are sick and have cancer,
Yeah.
which they're probably going to die from if it's not treated.
Right.
And then you step in, and then however many months later, they're better or they're healed. Your job is to make them better.
Right.
How does that figure into your motivation when it comes to coming in at 6 or 7 in the morning, all the studying through many years and training and so forth?
So that's kind of a multifaceted question. So when I'm seeing somebody, like let's say I'm seeing somebody with an early stage lung cancer that can't get surgery, I know there's an 80% likelihood that I can treat that tumor that they have successfully with a very non-invasive, quick course of radiation therapy, minimal side effects. So all day long, I could say, yeah, I feel good about what I'm going to do with you. Now, on the other end of that spectrum, and then it's same thing with like anal cancers. Anal cancers, we cured 90 to 95% of them. But what I do tell them is it's one of the most miserable treatments you'll ever go through, and I'm going to have to hold your hand, but that's what these next 6 weeks are going to be, is me getting you through the treatment. You're going to hate me at the end, but in 3 months, you'll be cured. You'll love me again.
You're like a tough high school coach.
Yeah.
Yeah.
And I think they do appreciate the bluntness, but I do. It's not even just being blunt to be blunt. They need to know what they're going to go through. It's like, yeah, we're going to cure your 95%, and then all of a they're going through the treatment. It's like, hey doc, I'm miserable. I can't go to the bathroom without feeling a lot of pain. You didn't tell me any of that. So you need to. So I tend to sometimes overstate the side effects a little bit, but other times I know that side effects is not going to be an issue. But if I think, you can sometimes eyeball a patient like, yeah, I think you're going to have issues, then I spend a lot longer. So anal cancers, early stage lung cancers, some other types of cancers that we can do very well with, I don't lose a lot of sleep over. It's the, let's say we're treating somebody for rectal cancer that we needed to shrink the tumor so that they can save the rectum, and the response wasn't as good.
That's different from anal cancer.
And that's different from anal cancer.
Okay.
So the rectal cancer is a different entity altogether. Mm-hmm. It always needs surgery. Anal cancer, 95% of the time, never needs surgery. And you're trying to tell them, look, the treatment didn't work as well. You're likely going to need the permanent colostomy. That's a very tough conversation to have with the patient. Similarly, pancreatic cancer.
Is that what Steve Jobs died of? Or that
he did die of pancreatic cancer. He died of the neuroendocrine type. This is the type that you can live, 5 to 10 years with. The other type, people live 2 to 3 years with on average. And most of the time they require preoperative therapy. I tend to see them later in their treatment. Usually they see the surgeon. Surgeon says, no, I can't operate right now. I can't get it all out. They'll send you to the medical oncologist. He'll start you on some chemo. They get chemo, and then they'll rescan, and then the surgeon will say, yes, I can take you, or no, I think you still need more treatment. That's kind of then when I see them at that kind of third stage, and then I'll evaluate them and right now I can say, look, I can offer you a very aggressive, short course of treatment. Instead of the traditional 5 to 6 weeks that we're doing, I can treat you in 5 days. And then I'll tell you, but in 1 month when we repeat your scans, your tumor is not going to shrink at all. And they're like, well, why are we doing this? Well, it's like the surgeon is still going to probably attempt to remove it after the radiation, even if it doesn't shrink. And he'll have a 50% likelihood of getting it completely out. If he's not able to get it out, I can say that the tumor will still be controlled and not grow for at least a year in 80% of patients. So that tumor is going to be controlled and not cause you any problems for that period of time. And then they're like, well, what happens if it grows after that? And then that's when I'm like, well, we'll have to probably start you on chemotherapy again and monitor you very closely and that sort of thing.